What role does the president or the White House have in making this partnership happen? Obviously, the GPA is getting the details done, but how did these two companies come together?
Well, as I noted in the opening, these obviously are two companies that are historically been competitors. So the fact that they are coming together speaks to the ability of this administration broadly to bring them to the table and work together to address the pandemic in the country. It was an across the administration effort. I'm not going to detail exactly which individual was in charge of each component, other than to say that when the president came into office, and as soon as we learned about the fact that Johnson & Johnson was behind in the manufacturing steps and efforts, we took steps to ensure we could expedite that and partner them with one of the world's biggest manufacturers.
And so is the administration doing this because J&J needs this production capacity from Merck to meet its commitments to the federal government for 100 million doses by the end of June, or is this separate from that?
Well, certainly our objective is to build on the incredible announcement that we now have 3 vaccines that the American people can have access to, can use to vaccinate them from and protect them from the virus. And we learned early on that they were, or not early on, but in the recent days, it's all relative, that they were behind on their manufacturing capacity. And so we took steps to ensure we could capitalize on the scientific breakthrough.
But this was necessary for the company to meet its commitments to the federal government?
I wouldn't put it in those terms, Zeke. I would just say that it was a step that helps ensure that Johnson & Johnson's vaccine can be, the production of it can be expedited, that the manufacturing of it can be expedited, and that's, of course, good news for the American people.
On vaccines, yesterday the topic of sharing vaccines came up in the president's conversation with the president of Mexico. The president said he was going to talk about it in that conversation. Is the president open to flexibility in terms of sharing these vaccines now with longtime American allies? And what is the threshold at which the president will start exporting some of these American-made vaccines overseas?
Well, that's diplomacy in action right there. The president's been at it for a long time, but the president did not make any commitments, nor did he give a timeline. His focus is on ensuring the American people are vaccinated. And yes, now we have more than enough doses. We will have more than enough doses to vaccinate the American people, but there are a couple of factors that our team looks at, including the fact that we don't know which vaccine will be most effective on children. We don't know the impact of variants, still under consideration and being looked at by our health and medical experts. We are, of course, securing all of these doses so we can plan for a range of scenarios. We have contributed to COVAX, which is the international coordinating body, to help provide assistance around the world. And certainly, when we get to the point where the majority, where we have vaccinated the American public, of course, we want the global community to be vaccinated. That makes us all safer.
We've heard from the scientists on some of these calls calling on governors not to roll back mask mandates and other restrictions on public gatherings. Looks like Texas and some other states are in the process of rolling back some of those very restrictions right now. We've not really heard from the president on that. Should we expect to hear from the president? Has the president been directly lobbying governors and state officials against rolling back these in private? And then should we expect to hear from him publicly going forward, encouraging the American people to follow his guidelines but not their governors?
Well, I will say, having traveled with the president to Texas on Friday, he made clear that we need to be vigilant, and that's also what Dr. Walensky conveyed over the last several days. It may feel a little bit better out there. That's good news. If you go to the grocery store, there's more toilet paper on the shelves. There's more Clorox wipes on the shelves. It's getting warmer out there. More people are getting vaccinated. People feel better. That's a good thing. But we need to remain vigilant. We are still at war with the virus. The president, of course, will continue to convey that publicly and also privately in his conversations. Let me see. Brett, go ahead.
Thank you, Jed. Just a couple of questions on the partnership. Can we expect, and what is the timeline by when we can expect the first vaccine to roll off of the lines of Merck's facilities? And has Merck started working on this new vaccine already?
I would expect there'll be more details from the Department of Health and Human Services on the contract and the specifics later this afternoon after the president's announcement.
And you mentioned that that the government has or is willing to invoke the DPA. Can you give us any more details on that?
We did invoke the DPA in order to alleviate 2 of the biggest bottlenecks facing Johnson & Johnson. One is fill finish capacity, which is actually kind of the bottle, the top that's put on these bottles of vaccines. And the other is drug substance availability, which is some of the components that make up the ingredients in the vaccine. So those were pieces that are steps. We invoked the DPA in order to implement those particular pieces. But the other piece that we are focused on here is ensuring that the Merck facilities are up to capacity of what's needed to manufacture the Johnson & Johnson vaccine.
Thank you. One additional question on the timeline coming out of this announcement. You mentioned that J&J is set to deliver 100 million vaccines by the end of June. Will this new partnership help Americans get these shots any sooner?
It should. It definitely will expedite the efforts of the United States government having enough vaccines on hand to vaccinate the American public. The president will talk more about that and give more specifics later this afternoon when he speaks to all of you. But certainly, having 3 vaccines approved by the FDA, the fact that we have taken these actions, we have used the full power of the federal government to expedite the manufacturing, that certainly should expedite the process and should make vaccines more readily available to Americans.
And one question on the First Lady, you mentioned her travel. She is set tomorrow to go out and tour some schools with the new Education Secretary. Wondering if you have any additional preview on this. I think she's visiting 2 schools that have found a way to reopen. Will she be speaking to some of the challenges that communities across the country are facing now as they deal with this?
She will be. She'll be traveling. That's what I was intending to provide more detail on at the top. I must have moved the paper out of my binder here, but she will be traveling with the Secretary of Education, who is just confirmed, as you all know. They will be having a conversation with at these schools that they're visiting that have reopened about what has been effective, what has worked, what are the lessons learned, what do they need more assistance with, and certainly that is information that they will take back with them after these visits they're doing tomorrow. That Secretary Cardona, his #1 priority is reopening schools, and so certainly taking a trip with the First Lady is an indication of his commitment to that.